Hello, I'm Dr. Fionnuala Williams. I'm a consultant psychiatrist in intellectual disability working at Limbank Hospital in Fife. And I've come to talk to you today about my wonderful specialty, intellectual disability psychiatry. Um, I can honestly say that I love my job, and it's certainly a career that I've had no regrets going into. Each day poses many challenges, but I also get so much pleasure out of the job I do. And I think my only disappointment is that less people know about our specialty than I feel should. And for that reason, I've sometimes referred to it as psychiatry's best kept secret. But I think it's time that we stop keeping the secret and letting more people know about the wonderful career that you can have if you choose to specialize in intellectual disability psychiatry. So, what is the specialty? So, it is psychiatry that specializes in the care of people with intellectual disability. You will also probably hear the term in the UK learning disability. Intellectual disability is the more internationally recognized term, but the use of the term learning disability is pretty widespread still in the UK, and the terms are essentially synonymous. So, intellectual disability is where somebody has a significant intellectual impairment, so that's usually defined as an IQ less than 70, an impairment in adaptive functioning, so an impairment in their ability to do day to day tasks, and it's a developmental disorder. So, the onset has to be before the age of 18. So that differentiates it from things like dementia, where somebody may have a acquired intellectual impairment later in life, but may not have had a pre-morbid learning disability, or, for example, a head injury in adulthood that leads to an acquired intellectual deficit. And there's a huge variety in ability in the patient group. You can have patients whose IQ is just slightly under 70, who may be able to maintain some forms of employment and manage day-to-day life with only a small amount of support. And those patients will present in a very similar way with psychiatric problems to people in general adult services. And then you can go all the way down to people with profound intellectual disability who require 24/7 care and support with all aspects of daily living. So there is really a broad spectrum of patients we see, which is one of the things that makes the specialty so interesting. It's a growing population with improvements in neonatal care. More babies who wouldn't have survived previously are surviving, and that includes some babies that have intellectual disabilities. But also improvements in adult medicine means that people with intellectual disability are living longer. One of the main advantages, I think, of intellectual disability psychiatry is that it's the subspecialty that lets you do all the other subspecialties. So why choose one specialty in psychiatry when you can choose them all by choosing intellectual disability psychiatry? We keep our patients on post 65. So we will see people who you would normally see in old age psychiatry who have a learning disability. So we will see people with presentations of older age, such as dementia. Psychotherapy, you can do training in forms of psychotherapy. For example, colleagues of mine have trained in family therapy, for example. If you're interested in forensics, people with intellectual disability come in contact with the law, and sometimes psychiatric input is required. So if you want to do forensics, you can do that in intellectual disability psychiatry. As I've already mentioned, people with mild intellectual disability may present in quite a similar way to people in general adult psychiatric services, but in intellectual disability psychiatry, you have the added bonus of having a wider range of professionals in your MDT who can help you with supporting those patients in the needs that they have. CALM's intellectual disability psychiatry is a fabulous subspecialty. It's one that I enjoyed working in and training. The children and the adolescents that you meet are wonderful to work with, and it's really interesting to work with them and their families to support their needs. It's kind of a growing specialty in Scotland. There, at the moment, isn't an inpatient unit for child and adolescents with intellectual disability psychiatry, but that's currently being developed. And another advantage of working in child and adolescent mental health services is that you get to work with the special schools, which are, the educational establishments are fabulous in supporting supporting our patients and kind of advocating for their needs, and can be a really good ally in helping meet the patient's needs in that subspecialty. At the moment, the only approved dual training specialty is CALMS and intellectual disability psychiatry, but there are plans to improve more dual training with intellectual disability psychiatry in future, and that's something that will continue to be developed in future. Another aspect of intellectual disability psychiatry, I think, is that it stretches you in many areas and means you have to use a wide repertoire of skills. Anybody who knows me knows that I'm a big Marvel fan, and so I'd like to say, why use one Infinity Stone? Why use one aspect of your gifts when you can use a wider aspect in doing intellectual disability psychiatry? So one aspect of that is that you can be a clinician and deal with a really broad range of presentations: mental illness, personality disorder, complicated behavioral difficulties. Some learning disability psychiatrists specialize in epilepsy, and that's their main area of practice, working with people with autism, ADHD. Whilst not necessarily dealing directly with genetic testing, we do often work in liaison with geneticists because there's more and more awareness of genetic causes of learning disabilities, which is relevant to how we manage people in psychiatry. Hospital liaison, if people have physical health problems, it will be the physician who's primarily responsible for their care, but often we're called upon to provide advice and liaison support in supporting our patient group when they are in physical health care settings. And addictions, people with intellectual disability can misuse substances as well. And again, often we're asked to work in liaison with addiction services to support them. So a huge, broad range of presentations, which makes it a very varied and interesting job. Being a legal expert, we are in contact with a broad range of legislation. It's not just the Mental Health Act. We're heavily involved in working with patients where use of the Adults with Incapacity Act is relevant. Often we take part providing opinions on capacity, providing reports. Adult support and protection procedures, which is a legislative framework to support vulnerable adults. Often we're called upon to provide input into those procedures, and in some cases have to refer our own patients who we have concerns about under that umbrella. And if people with intellectual disability come in contact with the law, the Criminal Procedures Acts may become relevant. And sometimes we use aspects of all these acts at the same time for some patients to meet their needs. This is an interesting area that's developing. You may be aware that there's the ongoing Scott review into the Mental Health Act at the time that I'm giving this presentation, and there has been a recent review into intellectual disability and autism in the Mental Health Act. So there's likely to be changes afoot in future, and this is an interesting and developing area. Being a researcher, there's some really exciting areas of research in intellectual disability, particularly in genetics, as I've mentioned. The DDD study, so that's the Diagnosing Developmental Disorders study, was a big study that did genetic testing in a huge number of individuals. And they found that on exomics sequencing that 50% of people with moderate and severe learning disability had a genetic cause. And that really potentially opens up a huge future for targeted treatments for specific genetic disorders. And there are trials that have either happened or are ongoing in the moment in areas such as Down syndrome, tuberous sclerosis, and neurofibromatosis, for example. Another big area of research interest in Scotland is looking at health inequalities. Although healthcare has improved and people with learning disabilities are living longer, the life expectancy is still much less than for the general population. So there is lots of work ongoing in Scotland, particularly via the Scottish Learning Disability Observatory that's based in the west of Scotland, looking at health inequalities and how we can support our patients with intellectual disability with that. Being an advocate, we don't necessarily have a formal advocacy role as such, like advocacy workers. However, our patient group can be vulnerable and can struggle to access services. And I see it as an important part of my role is using my position as a psychiatrist to advocate for their needs. Often I will write letters of support to other agencies, highlighting needs for input or highlighting to services ways that they can be potentially made more accessible for patients from our patient group, and supporting carers in terms of helping them as well accessing services on behalf of the people they look after. A huge advantage of working in intellectual disability psychiatry is the multidisciplinary team. I've worked in a number of intellectual disability psychiatry services in Scotland, and I've always had the luck of having a fabulous team working with me that's been dedicated to the patient group. CLDN, so that's community learning disability nurses who we work with, rather than community psychiatric nurses, CPNs. They have a much broader and holistic role looking at the wider health of the patient than CPNs. And I often say there's a few things more versatile than a learning disability nurse. The things that the nurses I work with will do for their patients and the support they give them is absolutely fantastic, and are really good colleagues to work with. Our patients often require significant amounts of psychology input, particularly if they're having difficulties with unsettled or agitated behaviour. So we have significant amount of psychology input into our teams and working with our patients. Occupational therapists, they're extremely helpful with sort of functional assessments, helping promote people's skill development, and also doing other things such as sensory assessments for people with sensory processing disorders. Because many of our patients have mobility issues, because they may have physical disabilities as well as a learning disability, physiotherapists are involved. Speech and language therapists, many of our patients struggle in their communication, and it can be a real source of stress for them, struggling to communicate what they want to convey and also understanding what's going on around them. So speech and language therapists are invaluable in helping us with that. We do have some involvement in creative therapies. In some services I've worked with, there's access to music therapy. Where I work currently, there's access to art therapy. So that could be sort of a good alternative for people that may not manage conventional psychological therapies. Dietetics, some of our patients do have peg feeding, for example, but they also support our patients with issues like weight gain and weight loss. We have podiatrists in my current learning disability team supporting us. And social work, in most of the teams I've worked with, that's not been embedded within the team, but we certainly work extremely closely with social work because our patients getting sufficient social care is a huge part of supporting them with their mental health. Most professionals who work in the field of intellectual disability are really committed to their patients and really enjoy working with this patient group. So we'll tend to also advocate strongly for their needs being met. So they're usually very supportive colleagues to work with when trying to advocate for your patient getting what they need. And also, when you have a patient with complicated needs, you're hardly ever alone in managing them. Usually there'll be at least somebody else from the team, another discipline involved. So that's very helpful to work kind of collaboratively and get support in helping meet people's needs when their needs are complicated. Another real advantage to working in this specialty, and something that always never fails to astound me, is the amazing patients I meet and their amazing carers. As I've already mentioned, you get a huge variety of presentations in intellectual disability psychiatry that makes it really interesting. They can be very complicated presentations, but it's what keeps the job interesting and enjoyable. And we do work hard to take a holistic and patient-centered approach. Often our patients' presentations are unique and individual, and that requires a kind of bespoke approach, an individualized approach to help meet their needs. And sometimes some of our patients may struggle with anxiety coming to psychiatric appointments, may have limited understanding what's going on, may have had bad experiences in hospital in the past. So often we have to work quite hard and quite creatively to help put them at ease and engage with us. And sometimes I've had to do things which are slightly outside of the box, trying to encourage patients to engage. I've sung frozen songs in clinic. I've bounced a balloon around the clinic room to help put a patient at ease and hopefully allow them to engage with me and hopefully get some confidence in the service. There are so many incredible carers, both paid and unpaid. The dedication that family members have to their relatives is incredible. The amount that people put in and go above and beyond, and also paid carers too. There's many very dedicated paid carers who I feel do more than they're necessarily paid to do because of the dedication to the patients. And the great thing about having carers involved is that there's very few of my patients who come to clinic by themselves. So usually they have some support in coming. And also that can support you in helping the patient with their psychiatric treatment, having the carers involved. It's a relatively small specialty, and Scotland's a relatively small country. So I do know a lot of the psychiatrists who work across Scotland. It's a fairly tight-knit group. A lot of us know each other. So it's quite easy to share ideas and get support from across the country if there are cases where you're wanting to seek further advice. That's me come to the end of talk. Hopefully I've conveyed to you what a wonderful specialty intellectual disability psychiatry is. And I'm happy to be contacted via the college. The address is here on the screen, and to discuss more if you want to know more about intellectual disability psychiatry. And thank you for listening to my talk.